patient living with cancer where there's no cure and treatment is ongoing, I'm constantly navigating the challenges of maintaining my health during treatment and avoiding unwanted side effects. Nutrition is a big part of that, but it's not the whole picture. I'm getting to the bottom of it with a respected oncologist in this Patient Empowerment Network Restore program. Dr. Comander, how can patients manage treatment side effects that affect their appetite or ability to eat? And what role does hydration play in supporting cancer treatment and recovery?
We know that many individuals going through cancer treatment really have a poor appetite, often don't feel like eating, and this can be due to a multitude of factors. Maybe it's due to nausea from the medication or other side effects from the chemotherapy agents or other medications that a patient's taking. So this can really be a challenge. And I encourage a patient to really talk to his or her doctor about these concerns if really poor appetite is a major problem, because yeah, actually, sometimes there's strategies we can think about. Sometimes there's medications that can be helpful to boost the appetite, or sometimes it's really thinking about introducing certain foods that may perhaps be appealing, such as making a smoothie. Sometimes, maybe you weren't a smoothie person before going through cancer treatment, but now that might be a great way to get in some calories. Obviously, you can put a lot of healthy things into a smoothie. So this is one strategy that some of my patients employ, but I certainly encourage someone listening to this to kind of talk to their doctor about this if it's a real problem, like not being able to eat. In terms of hydration, we know that is so important. Many of our treatments get metabolized by the liver or cleared by the kidneys. So it's really important to stay well hydrated, especially in the summer months if it's really hot outside. So I always encourage my patients to have a trusty water bottle by their side at all times. There's so many fun water bottles out there. So I'm like, get one that you like. If it has to be pink, that's great, whatever it is, but have a water bottle with you at all times. Certainly think about water, other drinks with electrolytes. Some people like Gatorade, whatever that might be, but it's really important to be drinking throughout the day to stay hydrated, to keep yourself healthy as you're going through cancer treatment.
Okay, thank you. Dr. Comander, what strategies do you recommend for cancer patients to maintain adequate nutrition when experiencing treatment side effects such as nausea or taste changes? And additionally, are there specific foods or supplements that can help alleviate these side effects?
Right. So many patients, when they're going through chemotherapy or receiving other treatments for their cancer, really note nausea, changes in taste, and have a really tough time finding what they want to eat during this time. And I will say, obviously, sometimes it's playing around with the diet to find what things work and what things don't work. And often that's the first thing we might try. But if nausea is the primary issue, I will say we now have such an amazing array of anti-nausea medications that we can use for our patients going through chemotherapy. And these are really game changers in the field of oncology. I can just see it even over my career, how some of the newer medications we have, such as olanzapine to use for nausea, are really beneficial. So I think if you're going through chemo and having a real hard time with nausea, and that's preventing you from eating, talk to your doctor. What other anti-nausea medication can I consider taking so I can get nutrition into my body? Taste changes, it really is something that can evolve often during active chemotherapy treatment. Patients may experience that. It tends to get much better when you're done with some of these drugs, such as cisplatin, for example, that can cause a lot of changes in taste. So that's usually something that's hopefully more of a short-term thing and will get better with time. In terms of specific foods or supplements, I really very much advocate that my patients get nutrition from whole foods with a focus on fruits and vegetables and whole grains. I'm not a big supplement person. In fact, organizations such as the American Institute of Cancer Research really counsel patients not to focus on supplements as a major way to get nutrition into the body. Of course, there are some instances where supplements are needed. For example, a patient with anemia could have deficiency in iron or vitamin B12. Those are supplements that may be necessary to help boost those red blood cells. Or one of my patients, for example, a diagnosis of breast cancer on an aromatase inhibitor where she may be experiencing a decline in bone density. She may need a vitamin D supplement because she lives in New England and doesn't get enough sun exposure, which is how we get vitamin D. So vitamin D, iron, B12, things like that sometimes are necessary, but there are a lot of supplements out there. that people are encouraged to buy and spend a lot of money on. And I really would encourage you to shy away from that. That would be my recommendation.
Okay, thank you. And a quick question for those patients who are on the flip side of the decrease in appetite. Sometimes patients going through cancer treatment are on high dose steroids and they have the increase in appetite and they have certain cravings. Do you have any suggestions or recommendations for those patients?
Yes, we know that we use steroids a lot in oncology to help our patients manage nausea or other side effects related to their treatment. And you're absolutely right. Being on steroids can sometimes really rev up the appetite, make it hard to sleep at night, cause a whole wide array of other side effects. So certainly with my patients who have this problem, sometimes I try to cut down the steroids a little bit, see if we can get away with that to kind of minimize those adverse side effects from the steroids themselves. But if someone really is having cravings, usually the steroids are used around chemo for just a few days. So I usually encourage them, like, again, if you're craving carbs, try to focus on some healthy carbs. Again, focus on whole grains, try to avoid some of the potato chips and other stuff, which we know are not so good for us. But usually it's a short-term thing, but maybe cutting down the steroids a little bit might be the first step, if possible, in collaboration with your oncology team.
Okay, thank you. You heard it here from Dr. Amy Comander. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.